Hi, everyone. It's Renee Nadia with Living Beyond Limits. I'm super excited to be here today just to come before you during this time. The Dominion Conference is fast approaching, and I am getting ready to interview a young lady, Dr. Naomi Watkins Granville, who's going to be a part of our conference, and she will be doing a workshop entitled Strong, Smart, and Self-Aware, Redefining Women's Health Through God's Design. And this is so amazing, ladies. You don't want to miss this when she comes. You don't. We have some amazing speakers. She is coming full force. I told her, do not hold back with whatever it is God has placed in her to say, because as women, we are falling to the wayside with our health, and that needs to end. Again, ladies, the Dominion Conference, March 6th and March 7th. There's still room for you. You know who I'm talking to. Come on and register right now. All right, Dr. Naomi, thank you for just gracing us with your presence today. You are a busy, busy lady. And the other thing is, you shared with me that even when you come to the conference, you're on Friday morning and you will be leaving work at 6:30 a.m. to come to us. So I want to say thank you. Everybody, a lot of the women who are part of this, life is life, and people are work and people have children, all those types of things. I'm just really thankful and honored that you're going to come and be with us. And after it's over, I'm sure you'll be passing out once it's all. But we'll have you for the entire day. I'm super excited. We really, really appreciate it. So for starters, can you share with our audience a little bit about your background and a little bit about yourself? I know you have a lot of college under your belt. Things, if you want, I don't know. It's up to you what you want to share. Go for it.
Yeah, so I went to undergrad at Rutgers in New Brunswick. I got a bachelor's degree in biology. I had a minor in Africana Studies. Then I went and got a master's degree at NYU in biology, where I just basically studied human biology mostly. I was like a graduate teaching assistant there. I also was a medical scribe for orthopedic surgeons. And then after I graduated with my degree, I transitioned into a job as a clinical care tech and like an ambulatory technician. So basically, I just helped out nurses with the things that they did. Also, I drew blood, did EKGs, did like very like hands-on interaction with patients, helped them with their care. And then I went to medical school. So I went to Rowan University School of Osteopathic Medicine for my medical degree. I'm now a general surgery resident at Temple University Hospital. Like maybe 7 or 8 months in. And yeah, I love being a doctor. I love what I do. I love the work. And yeah, here I am.
Yeah.
Busy but happy. Yeah.
Yeah, absolutely. We have lots of conversations about the things you do all the time. And so it's pretty exciting things that you're involved in. There's a whole bunch of other stuff you do outside of that, but we'll stop right there. People will learn more about you later. This topic, Naomi, and you and I talked about this. I felt like it was imperative that it be a part of the conference.
Yeah.
One of the funny things is about you being a resident is like, I just noticed as we're talking, have conversations, you can spit out anything about anything. And I guess as time goes on, you'll be in your respective area that you want to be in, which is what eventually after residency.
Yeah, after residency, I want to do breast surgical oncology, which is basically treating breast cancer like through surgery. Also, like collaborating with medical oncology, which is basically people that give chemotherapy and radiation. Those are radiation oncologists. And then also, like the field of breast surgical oncology is very research heavy. So, there's a lot of like work that needs to be done scholarly. So, as a breast surgical oncologist, you're charged with performing studies that advance the field.
Mm-hmm.
And then there's a whole other space that I'm really excited about, which is just like advocacy and education. Black women are disproportionately affected by breast cancer, and Black women die more often from breast cancer and are more often diagnosed with breast cancer at a later stage. So having people in the field who are trying to help close these gaps and disparities is extremely important. So it's pretty loaded work, I would say, having to operate on people, but also having to push the space forward, whether it be in a way of advocacy and, academically.
That's good. And I'm glad you went there because what I was going to say, when we chat, you're like spitting out so many things about different things that you've learned because they made you learn all these things.
Yeah.
And that just takes us right into this whole women's health arena. And at my age, I see what it started. A lot of women, I noticed, I feel like we leave the earth too quick, sooner than we should,
Mm-hmm.
as healthy as we should be. And we'll
Mm-hmm.
the excuse that, oh, well, I'm this age. And I'm
Mm-hmm.
thinking, like, it doesn't matter. Like, you still can be healthy at any
Mm-hmm.
and I think that that's kind of like what happens where we start making excuses for where we are health
Yeah,
wise instead of trying to make the necessary corrections.
exactly. Yeah, I do agree. Mm-hmm.
Yeah. So one of my first questions is, what does it truly mean for women to be strong according to God's design?
Yeah. So I think like I'm, trained in biology, so um I'm always like in awe of like God's way of creating us. I think it when I sit back and think of how many things work together so well, and how many things have to go right for, you to be designed the way that you are, it actually truly makes me feel like we just don't truly appreciate our bodies and ourselves in the way that God would want us to. Because for us to be this perfectly created being, this perfectly functioning and fluid and knowledgeable and capable person, right? When
Mhm.
you truly appreciate that, you would say, hey, I really would want, the best, feeling the best in this body, or like, giving it its best and understanding that I'm not supposed to be, this XYZ weight, or I'm not supposed to have this type of disease or disorder, right? Like, because when you feel like you're in perfect design, or you have the perfect design, you want to feel and be that way.
Mhm.
So I think that um leaning into that and understanding that you're made special and in a way where you need to cherish and appreciate it is probably like the first step to that question and that conversation.
Yeah, and I think that's good. And it's scriptural that the Bible says we're fearfully and wonderfully made.
Yes.
We're created in His image.
Yes.
And I feel like sometimes when we don't feel like that, we should say why. But a lot of times
Hmm.
we accept a lot of things because of what the doctor said. Some doctors say, or some doctors tell us, or what, or some family people say, "What it runs in my family." That cringes me when people say that. I'm sorry if you
Yeah.
say it, but because we have power in our words, and you'll hear people say that
Hmm.
nothing,
Hmm.
right? And I believe those are some things that can get in the way. Um, the other question I have for you is, how have we confused being strong with silently enduring exhaustion?
Mm. Yeah. I think that is like kind of an age old question, for women. Like, we've seen generations of women in our lives do and be the same things, right? I think that I think it's like that's a hard question to answer, but I think that every woman should at some point sit back and say, how are the relationships that I have, the habits that I've formed, the life that I've created, what how do I feel in this space, right? Like, do I want to keep going in this manner? And if I had a daughter, would I give her this blueprint to my life and say, you would be happy, healthy, thriving if you had this format, right?
Mhm.
And sometimes, and probably, I would argue, like, we all want better for our children, but we have to want better for us too, right? If you would say, hey, I would not replicate this life for myself another time or for my daughter, then that's probably a sign that you should make some changes.
That's good.
And it's not too late for you to do so. It's just a realization that you come to when you say that, hey, as a woman, I've created this kind of way about myself that I've probably seen my mom do, that I've probably, seen my aunts and all of these people do.
Hmm. Hmm.
But if I wouldn't do it again, or if I wouldn't recommend somebody I love to do it, then it's probably time to make some changes. And I think another thing to realize is that your situation can directly affect your physical being.
Hmm.
There are women that have like autoimmune disorders, that have literally resolved when they've left a relationship.
Mm.
There are women with chronic conditions, not a joke.
Mm.
And there are women with chronic conditions that are directly connected to your central nervous system that can resolve after you've reached a level of calm, content, feeling like you're at peace, all of those things. And one example that comes to mind is like IBS. It's called irritable bowel syndrome, right?
Mm-hmm.
You have like these fluctuations in your bowel habits because of anxiety. So
Mm-hmm.
if you're leading a life where you're constantly anxious, you're literally directly affecting your health.
Mm.
Autoimmune disorders like flares and things like that are directly connected to stress. And so I think, yeah, that was a long way to answer your question, but again, would is the life that you're leading or what you have or how things are going, is it affecting your health, and is it again something that you would want to continue to do or be, knowing what you know now?
Yeah, that's good, Naomi. That's good, girl. You about to bring it this weekend. And I you and I had a conversation. I said, bring it. Do not hold back, right? 'Cause you got to bring it. My next question is, what are some health myths that Christian women tend to believe?
Oh man, oh goodness, I wouldn't even isolate it really to saying, um actually you could isolate it to saying Christian women, but I would say that like Christian women, a lot of times we we need to understand that God has put people in positions to help us with our health, right? Like we can pray, we can lay hands on each other, lay hands on people for healing, for a breakthrough, for change, which all is phenomenal, right? But medicine works. But seeing a doctor works. And God has put people on this earth to be experts in their fields, to create these medications that can help you. And ultimately, right, we can pray for discipline, that we continue to go to the gym, that we continue to eat right. We can pray for the foresight for where we want our health to be. We can pray over each other to be disciplined. We can pray over each other to overcome certain things. We can even pray over each other to find the right people, right?
Mm-hmm. Mm-hmm.
But prayer is an essential part of our health. However, so is the people who God has put on this earth to help us be healthy, right?
Mm-hmm.
And I don't want to minimize the power of prayer and God's intervention, but it is in a way a little bit lazy.
Mm-hmm.
Faith without works is dead. We know that.
Mm-hmm. Come on,
And so
say that again.
I said faith without works is dead, okay? But yeah, and so I think it is in a way the easy way out.
Yeah.
And it's not yeah, it's not the way that God would want us to live.
Mm-hmm.
And so I'll also say that another thing, like especially with like Black people, is we have been inflicted and mistreated in the health space 120 times over, right? And a lot of the things that we deal with in our families is a direct result of slavery, and how we've gone through generations of mistrust, mistreatment. And I think, like you were saying before, this runs in my family. Again, is it's a lazy way of thinking. It is a way of thinking that we have to get out of, because to some extent, right, what you eat is cultural. It does run in your family. There is a component of what we call epigenetics, where it is a portion of genetics that could predispose you, but it doesn't determine your health outcome. And so, again, to say, I was always going to get high blood pressure, untrue. I was always going to get diabetes, untrue. And even if you do happen to acquire it, you don't have to keep it because your mom died with it, because your dad died with it, because your dad died of it. Like, all of these things are not a part of your destiny because your family had them. And so I think that's another thing that we have to kind of just get out of. You're not on that trajectory because you're born. it's different than that. And you can determine your overall health and quality of life if you don't just settle into, oh, this just runs in my family. Yeah.
And, I've heard people say things like, yeah, I have this pill, that pill, and the other one. Well, how many are you taking? And I'm like, none. And
None.
people are like,
You don't take any medications.
I don't, I don't, right? But I only thank God for that.
Yeah.
Trust me, I just thank God for that. But I've heard people say that, women especially say, well, at some age, everybody's taking something.
Untrue.
I don't believe that either.
Yeah, it's not true. And I think you're kind of a direct reflection of that. And not everyone is as blessed to not have like chronic conditions that they
Correct.
couldn't control and
Correct.
stuff like that. However, though, the things that we can control,
Right.
we can reverse and we don't need pills for.
Mm-hmm.
And so that's why you're like an example of someone who I'm like, you don't need, no, you don't have to be a certain age and take medications. You don't. Yeah.
Yeah, and that's good news, because I think it should encourage someone to say, you know what, maybe my thinking was a little off about this. And like you said, I'm sure there's situations where it's beyond your control, control to a
Right.
certain
Yeah.
level, and you have to do that. We've had that conversation, so that's a little different.
Mm-hmm.
We're talking about other things that just maybe they can be avoided.
100%. Yeah. Mm-hmm.
So my next question is, how do we become more aware of what our bodies are trying to tell us?
Yeah. I would say it really is just the first thing is just like being in tune with yourself, right? Like taking time to tune down the noise and assess where you're at, right? A lot of women, we're very distracted. And a lot of people's health comes way before our own. And I think the first step is making your health and your body a priority.
Mm-hmm. Mm-hmm.
Because when I'm in the hospital, I will ask men, what medication do you take every day? They say, I don't know. You have to call my wife.
Oh.
Literally.
Mm-hmm.
Like they're in the hospital bed and we have to take care of them and order their home medications.
Mm-hmm.
And I have to call their wife to ask their wife what they take every day.
Mm-hmm.
So women are literally taking on other people's health, literally.
Mm-hmm. Mm-hmm.
And I can't even imagine if somebody's actually very ill, how much of their own self they're putting on the back burner.
Mm-hmm.
So and then if you have children, if you have sick parents, if I can't even imagine how many other people's health you have on your mind beyond your own.
Mm-hmm.
And so the very first thing is to make your health a priority. Sitting and asking yourself, when's the last time I saw my primary care physician? When's the last time I went to an OBGYN? When was the last time am I due for a colonoscopy? Am I due for a mammogram? Like all of those things, yes, it may take time, but the very first thing in assessing where your health is at is making it a priority.
Mm-hmm.
It is extremely easy to just coast and make sure everybody else is okay. And you made an extremely good point in the beginning. You said that women are dying too young. Mm-hmm. And yes, like women pass away sometimes before their male partners. Mm-hmm. And then their male partner will die shortly after because there's nobody helping them with their health.
Where's the medication? I don't know.
Exactly. Right?
Right.
So, and it's like, we have to understand that everybody else, like if you can manage this person's 10 meds every single day, they take 4 meds in the morning, 4 meds with lunch, 4 meds with this and this at night, every single day for decades, you can do the same for yourself. You can sit down and be like, what am I going through? What's my blood pressure? What has my blood sugar been at over the past 3 months? What are my vitamin levels? Like you have to be able to put your health in the front. That is the very first thing.
Right. And I don't know if you mentioned it. So what are some of the common symptoms? Like headaches or just being anxious or feeling anxious. I know you brought that up. That might that will point out that it's time to sit down and get yourself checked out.
Yeah.
Yeah.
I would say that for younger women, like women in their 40s, I would say like chronic fatigue is probably the very first thing that should strike someone to be able to go see like a primary care doctor, because at that point there's levels of what exactly it is that could be causing it, right? So iron levels, vitamin D, B12, thyroid, all of those things you can just get in a simple panel of blood work,
Mm-hmm.
right? And they're easily correctable once you identify it.
Mm-hmm.
And so I think that's the first symptom of a woman kind of not necessarily needing to take care of herself a little bit more or paying attention more to her health,
Mm-hmm.
would be fatigue. I would say the second thing would be bowel habits. I think your bowel habits are connected to the way you eat, what you eat, also like your nervous system, all of those things.
Mm-hmm.
And another just thing is that younger people, unfortunately, are getting colon cancer, primarily because bowel habits and things that are kind of like misidentified in younger people.
Mm-hmm.
So I would say bowel habits is another one. So we talked about fatigue, bowel habits, and then I would just say like, yeah, I think those are probably like two of the biggest things.
Yeah.
Yeah. Mm-hmm.
What role does rest play in God's design for women's health? I mean, we talk
Yeah,
about this
huge.
so much. Yeah.
Huge. Yeah, it ties into exactly what we were talking about before. Like rest kind of resets you for the day. I mean, if you get proper rest every night, it decreases your risk for dementia, and like memory related disorders as you age.
Mm,
It also just sets your tone for the day. It kind of makes the things that you do during the day worth it, right? If you're studying, it helps with memory retention. If you're working out, it helps with muscle recovery.
mm,
All of the different things sleep's beneficial for. And you know, a couple things, like we're blessed to be in the year of 2026 where there's so many things that help you actually become conscious of what things look like during your day, right? Like you have the Apple Watch, you have the Fitbit, I have this ring on my finger, it's called an Aura ring. It tracks my sleep, you can put in your meals, it actually tells you when you're stressed,
mm.
all of these different things. And so there's like, as the years go along, there's fewer and fewer reasons why you shouldn't you shouldn't, be not able to pay attention to your health and what goes on in a day. So
Right.
yeah.
Right. That's good. And how can emotional wounds show up physically in the body? I think that there are a lot of women who are sick for that reason and they don't even know it. So, how can emotional wounds show up in the physical body?
Yeah, I think this is like literally what we call like PTSD and being traumatized and
Mm,
um, things like that. Like emotional attacks or emotional experiences have what we call visceral responses, which are physical responses. So, for example, right, like you had an issue with public speaking when you were a child, right?
mhm,
Maybe you were laughed at really badly when you tried to go up and speak. And now every time that you have to speak in public, even as an adult, your heart just starts to beat really fast. You feel like the room's closing in, you can't hear anything. You are completely unable to do so. A lot of women, they'll take like a beta blocker right before they have to speak in public. It brings their heart rate down and they can go in public in front of people and speak. But again, that's kind of what these emotional wounds will do to us.
mm,
It'll have like a visceral reaction or a visceral response that we literally can't get rid of, and it doesn't go away
mm,
as we get older. And I will say, like, there are times where certain situations perpetuate those feelings, right? Like being around certain people or being in certain types of relationships can be more of a trigger than others.
mm,
And in which case we have to sit down and tell ourselves, like, is this like kind of bringing me back,
mm.
or am I regressing, or are these wounds opening up because of this person, because of this job, because of this thing, right? um and so all of those things play a part.
Yeah. That's good. That's good. So, and my next question is, how has culture distorted God's design for women's health?
Oh my gosh, it is like remarkable for me as somebody who's in the medical field to see how culture shifts and changes the way that women see themselves. I
Mm,
mean, we're no stranger to it being. At one point, it was in to be super skinny, and then now it's in to be thick. Then it's skinny. Then it's medium. Then it's this. Then it's that. And it's like women are permanently altering themselves to fit a fad or a trend.
Mm,
And most of the time, again, like we talked about design, you're not designed to be that weight. You're
mm,
not designed to be that shape.
mm.
You're not designed like you're not. That's not the design.
Right.
And it's like you're forcing it, causing making these permanent alterations,
Mm,
and then in 1 year you're gonna want it to be gone again.
mm, mm,
And it's like it's amazing because you can't change your body that fast for trends.
mm,
Even the people who you see in the media, right? Even that's not sustainable no matter how much money you have.
mm.
They can probably keep up for a little while.
Right.
But then eventually when they turn like 40, you look at them, you're like, oh my gosh, who is that?
Mm-hmm, mm-hmm.
Like they almost don't even look like themselves or a human being or anything because they've nipped, tucked, snipped, removed, changed, altered all of these parts of themselves.
Yeah.
And there will be even, television is funny because there'll be even shows where there's shows like called Botched and all these things, but people will say like my breast implants made me physically ill. Like this augmentation or this reduction, I'm actually sick from it.
Mm,
Like there's a trend now with women are getting their breast implants removed
mm,
because they're like they hurt, I feel sick,
mm,
I never needed it in the first place.
mm,
Like
mm.
all of these things.
Yeah.
And then when Kim Kardashian finally decides to remove her butt implants, you don't have the money to really remove yours
Yeah.
and look normal again.
Yeah. Yeah.
And so it's like, you can't what's your design? How did God make you?
Yeah.
And if I want an enhancement, how can I do that naturally?
Mm-hmm.
If I want to look thinner, how can I do that naturally? Because you can't make these permanent alterations based off of fads and like things that fade and temporary things, right?
That's really good. That's really good. How does being healthy position us to fulfill our purpose and assignment?
Yeah, you cannot do anything if you're not around to do it.
Mm, mm. Come on
If
now, right?
like
Mm-hmm.
seriously, if you're not here,
Mm-hmm.
who's going to do it?
Mm-hmm.
If you're not you walking into that hospital or walking into that job, if it's not you, it's not going to get done. If you're not around, if you're not there, it's not going to get done.
Mm-hmm.
If you're laying in a hospital bed somewhere, if you're ill, if you're unwell, if you can't get there, that's somebody or people who are missing out on your gift. And you got to remember that.
Yeah. 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 That's
Yeah,
good.
it's going to be you. You got to be well enough to get there and to do it.
Mm-hmm. That's really good. Um, and we're almost finished here, doctor, because I know you have to, back to work. Why do so many purpose driven women neglect themselves?
Because it's easy to do when you have a lot to do.
Mm, mm,
Yeah.
mm, mm,
It's easy to do when you have a lot to do. And I'm guilty of it. Like a lot, like there's always something that's a little bit more important.
mhm,
There's always, something that is a little bit more urgent.
mhm.
There's always something that kind of takes a little bit too much out of you. And the reasoning is because of how elevated you've made your goals and your purpose,
Mhm.
right?
Yeah, oh, yeah.
And again, you didn't make you being your best self and feeling your best as elevated as what you do,
Mhm,
right? And all of that ties back into us saying, right, we can't go and do and be all these things that we want to be if we don't also take care of us as well.
yeah.
So I think, yeah, a lot of women who are very driven and very motivated, there's a ton of reasons.
Mhm,
There's always something.
mhm,
And there's always a better, good reason for it to kind of just be put on the back burner for a little while.
mhm, mhm.
But I think, again, prioritizing yourself.
Yeah.
Yeah.
And you have a really tight schedule. And we talked about this. What are some of the things you personally do to make sure that you're penciling in that time so that you don't feel overwhelmed, you don't feel overloaded. Like, is there a
Mhm.
certain time you go, wait a minute, this is happening or that is happening, or I'm feeling this kind of way, time to back up and regroup or something like that? Like, how do you manage your time and your day with being so extremely busy?
Yeah, I just recently started doing a lot better with this, but implementing like time to just like move my body, I would say I come up with very obtainable goals, right? Like, with residency, I'm not able to do nearly as much as I used to. So I think the first thing was adjusting my expectations. I think that's the very first thing that women can do is adjust your expectations for yourself
Mm-hmm.
and make sure you give yourself grace, but also don't give yourself excuses, right? So there's like a fine line between those two.
Right, right. That's good. Mm-hmm.
I would say make attainable goals, but then also create rules for yourself. So, like for me, I would say if I get home from work before 7 p.m., I have to go to the gym. Like, not a question. And if I get home from work after 7 p.m., at that point, I'm sacrificing like life things, right? I need to eat, I need to take a shower, I need to like at that point, I'm sacrificing things that like actually truly have to be done.
Right.
So, but if I walk in the door at 6:42, my gym clothes are going on and I'm going to the gym. That's the rule.
Mm-hmm.
And so like creating those types of goals for yourself, and like for me, a goal of mine years ago would be gym 5, sometimes even 6 times a week. But adjusting my expectations for myself was saying I can go 3
Mm-hmm.
times a week. And if I make it to 4, then I'm like, fantastic, right?
Mm-hmm.
So adjusting your expectations, making sure they're attainable, and then you don't create reasons to make excuses for yourself. And then also just creating rules for yourself that make sense.
Mm-hmm.
Also, planning is really important as well. Like if you don't plan out, for example, things like meals, it's really easy to just go pick up and grab something that doesn't necessarily align with your goals.
Right, right.
So planning ahead is really helpful. It also makes your life a lot easier and you do tend to save money.
Mm-hmm.
So planning helps with that as well. So those are just like a couple examples.
That's really good. And lastly, if a woman walks away from your workshop changed, what will she understand about her body that she didn't before?
Yeah. I would say that she would understand that, yeah, that making her body and her health a priority is a non-negotiable.
Mm-hmm. Mm-hmm.
Like, and that nothing, very few things in your life are reasons to not prioritize it and take care of it.
Mm-hmm.
Um, and that again, you are made and designed in a way that is very intentional and very specific. And if you want to honor God, you have to honor your body.
Mm-hmm.
And any time where you're putting that on the back burner or, just neglecting it, you have to remember that it's out of God's will and intention and design and what he wants for you. Um, and, so like it's, yeah, it's really just to be and perform in a way that God intended.
Mm-hmm.
And you yourself can help move that forward.
Yeah, and lastly, Dominion is the theme for the conference. How do you see that as fitting into exactly what you just shared?
Yeah, I mean, taking dominion over your health and your life and the trajectory of your health. I think, again, there's so many things that bring us dominion. I think of like elevation, higher, conquering, right?
Mm-hmm.
There's so many things that can make it feel like we don't have dominion over our physical body,
Mm-hmm.
over our health, and really truly taking away those things that can make it feel that way,
Mm-hmm.
right? Just like taking control back.
Mm-hmm.
And that's honestly what I hope women take away.
Absolutely. Well, thank you so much, Naomi. Dr. Naomi, I'm telling you, I told you, y'all, she gave you just a little bit. She's going in. She's going in. She's going to go in. And don't be afraid, ladies, because this is what we need. She's going to go in. And so I'm so excited. This was just a little bit. You're going to get a lot more. Thank you, Dr. Naomi, for your time. I am blessed to have you. We even tried to get you for 2 days, and we couldn't. So we're okay. We're okay with the one. We will take it. We will take it. See you when you get there, 7:30 a.m. But anyway, so we're super excited, ladies. Thank you, Dr. Naomi, again. Ladies, March 6th and March 7th. Well, Dr. Naomi will be there on Friday the 6th. I got that correct, right? That's the day she will be there. You don't want to miss this. I'm telling you, ladies, this is going to be a blessing. And dealing with our health and getting it right is a game changer. She's coming for us. She's coming. Just seatbelts on, but it's good stuff. All right, ladies. Hope to see you March 6th and March 7th at the Dominion Conference in Mount Laurel, New Jersey. It's still time to register if you have not already. Hope to see your face in the place, and Dr. Naomi will be there as well. And all the other ladies and panelists and workshop, it's going to be on and popping. All right, ladies, till next time, be blessed. Love you and peace.
Bye.